Governor Andrew Cuomo now talking about the alleged cover-up of those nursing home deaths. Let's listen.
It's difficult to impose curfews, but otherwise people die. And these decisions should not be politicized. If you made these decisions by a poll, none of them would happen, and more people would die. I want to clarify facts on the nursing homes, which has been an ongoing discussion. New York, as everybody knows, was ground zero for COVID, and nursing homes were and still are ground zero for COVID. And losing a loved one is very, very painful. Losing a loved one in a nursing home during this situation was extraordinarily painful. There was no visitation. You couldn't be with the person. You couldn't talk to the person. It was hard to get them on the phone. People in nursing homes are not as conversant and facile on Zooms and on FaceTime. I mean, it doesn't work that way. So I understand fully how difficult it has been, and I want to make sure people have all the facts, the information. This past year, there is a toxic political environment, and everything gets politicized, and there's political spin, and then there are facts. Two very different things. And I just want to make sure people have facts. Last August, Department of Justice sent a letter to Democratic governors, 4 of them, New York, New Jersey, Michigan, Pennsylvania, asking for information on public nursing homes. New York State Legislature also sent a letter asking for information on nursing homes. We paused the state legislators' request while we were finishing the DOJ request. We told both houses, the Assembly and the Senate, that we had DOJ requests for information, and we were prioritizing that. We did give the DOJ request precedence, and we told both houses that. The August request we replied to fully. Separately, DOH got a DOJ letter signed by Jeffrey Clark, the attorney, in October, which we learned about from the New York Post. We didn't even get the letter. Post called and told us about a letter. And that requests information on an investigation on private nursing homes. And we have been voluntarily producing information for that on a rolling basis as recently as January 8th, as offered by DOJ, the rolling basis production. Second, we paused the state legislature's request. We paused the state legislature's request. We voluntarily complied with the DOJ request for information. Two very different things. The New York State DOH has always fully and publicly reported all COVID deaths in nursing homes and hospitals. They have always been fully reported. Nursing homes had the most vulnerable population. We know that. Nationwide, 36% of the deaths are in nursing homes. You know what percent of the population are people in nursing homes? 1%. 1% had 36% of the deaths. New York is 34 in nursing home deaths as a percentage of total deaths, 34 out of 50 states. New York is one of only 7 states that counts what's called presumed fatalities in nursing homes, where the nursing home presumed the cause of death was COVID. To give you an example, New York State 13,000 nursing home related deaths. That's 30% of total deaths. Pennsylvania had 11,900. That's 52% of their total deaths were in nursing homes. Florida, 34% of total deaths in nursing homes. Massachusetts, 54% of total deaths. If you look at the entire country and you look at the percentage of deaths in nursing homes, New York is number 34. You have some states that up to 73% of the people who died in nursing homes. COVID preys on senior citizens, older people, weaker people. We've always known that. That is a fact. Now, there is much distortion around what's called Department of Health memo on March 25th. And I want to make sure that we get the facts on this. On March 13th, Federal Center for Medicaid and Medicaid Services, what they call CMS, and on March 23rd, the Center for Disease Control, CDC, put out guidance sending people from hospitals back to nursing homes. New York State DOH followed that guidance. 12 other states, at least, followed that guidance. The CDC, CMS, DOH reasoning at the time, residents who were leaving the hospitals were not likely to be contagious because at that time, the viral load is so low that you're not contagious. And they were going to be what's called cohorted, cared for in areas that are separate with other people under the right precautions. Patients, particularly senior citizens, should not remain in hospitals longer than necessary because they can get a secondary infection. That's true all across the board, especially with seniors. They try to get the procedures done. They try to get people out of the hospital before they can come up with a secondary infection that's problematic. The patients were not sent to nursing homes. The nursing home had to agree that they could care for this person. That is a matter of law. They cannot accept a patient who they are not prepared to care for properly, staff, PPE, ability to cohort. That is in the law. If they don't do that, they violate the law. At the time, remember what was going on in March. The experts were projecting that our problem and our critical need was hospital capacity. We sat here every day with the hospitalization chart. We were looking at up to 140,000 people hospitalized. We have less than 50,000 hospital beds. That is the calamity. Remember, March 25th, that's right when the New York City Health and Hospitals Elmhurst Hospital collapsed. It was national news. I remember it like yesterday. And we're watching the TV every night and watching Italy collapse and people die because they can't get into a hospital. We're watching China with a hospital capacity issue where they were building thousands of new hospital beds. That's what was going on. That's why the CDC and that's why CMS made those decisions. And at the time, CDC, CMS, there were White House task forces, there were daily briefings. Everyone was focused on this issue. This was not a little issue. All the best minds were looking at it. Fact. Of the 613 nursing homes, we have 613 nursing homes in the state. 365 received a person from a hospital. Of the 365 that received a person from this March 25th guidance, which was then superseded in May, 98% of those 365 already had COVID in their facility. COVID did not get into the nursing homes by people coming from hospitals. COVID got into the nursing homes by staff walking into the nursing home when we didn't even know we had COVID. Staff walking into a nursing home even though they were asymptomatic, because the national experts all told us you could only spread COVID if you had symptoms. And they were wrong. COVID may have been brought into a nursing home because visitors brought it in and didn't know they were contagious, because the guidance was you can only be contagious if you have symptoms, if you're sneezing, if you're coughing. That turned out to be wrong. That's how COVID got into the nursing homes. 98% of the people who took a person back from a hospital who was probably no longer contagious already had it in the facility. And they signed and agreed that they could handle it because they already had people who were COVID in the nursing home. If you look at the rate of death before the March 25th order and after the order was rescinded, the rate of death is the same. By the way, if you look at the rate of death in the nursing homes, in the spring overall, and in the second surge, the winter-fall surge, the rate of death is the same. These decisions are not political decisions. They're all made on the best information the medical professionals have at the time. And in New York, we talk to the best experts on the globe. And I've said to the people of the state many times, nobody's been here before. Nobody knows for sure. COVID is new. They're all giving you their best advice at the time. And these are really quality people. Dr. Osterholm, Dr. Fauci, all the main institutes that were giving advice to the nation. We had people come from the World Health Organization who dealt with China, who came to Albany literally to advise us. We're blessed to have Dr. Howard Zucker as our health commissioner. He's trained at Harvard, UPenn, Johns Hopkins, served at HHS, WHO, NIH. He teaches at Columbia and Yale University. If we had to pay him what he was worth, we couldn't afford it. And he gave his best advice on the information that he had at the time. I would trust Dr. Zucker with my mother's care. That's why I trust him with your mother's care. I wouldn't have anyone as the health commissioner who I wouldn't trust with my mother. And that's why I trust him with your mother. To be clear, all the deaths in the nursing homes and in the hospitals were always fully, publicly, and accurately reported. The numbers were the numbers, always. People did request information beyond the place of death, not just how many in a nursing home, not just how many in a hospital. They did request different categorizations beyond those counts. How many people died who were in a nursing home but then went to a hospital? How many people died who were in a hospital but then went back to a nursing home? How do you count presumed COVID deaths? Everyone was busy. Everybody was here every day. We're in the midst of managing a pandemic. There was a delay in providing the press and the public all that additional information. There was a delay. What did we learn from this entire situation? What are we still learning? There are hospitals that perform well, and there are hospitals that performed less well. We still see hospitals performing less well. When you look at those vaccination numbers, hospitals with the same demographics of workforce in the same region, with different vaccination rates of their staff, that's indicia of performance of those hospitals. There are nursing homes that performed well, and there are nursing homes that did not perform as well. We have to learn from it, and we have to correct it before we have another surge and another pandemic. And by the way, we are going to have another pandemic. As I sit here, I would plan on it. And yes, this was never seen before. And yes, hospitals had to deal with something they never had seen before. And yes, nursing homes had to deal with something they had never seen before. But they will see it again. And now we have to learn from it before it happens again. Our focus, I believe, is going to be on the for-profit nursing homes. Hospitals, low-performing hospitals, but also in the for-profit nursing homes. I have long believed that there's a tension in a for-profit nursing home because those institutions are trying to make money. If you're trying to make profit, it's too easy to sacrifice patient care. Everything becomes one or the other. Do you want to hire more staff, or do you want to make more profit? Do you want to buy more PPE and stockpile more PPE, or do you want to make more profit? Do you want to buy new equipment, new beds, new sheets, new furniture, invest in the facility, or do you want to make more profit? That tension is a problem. And that has to be resolved legislatively, because I don't want to leave it to these for-profit owners to decide what's right, what's wrong. Let's learn these lessons. We have to implement hospital reform and nursing reform, and we have to do it in this budget cycle. COVID isn't done with us. Implement the lessons now, and we're going to propose them in the 30-day amendments. If you're a for-profit nursing home, I believe it should be mandated how much you put back into the facility and how much profit you can make. I believe that. Nursing home hospitals that have these issues, they have to improve, and we have to take it into consideration when there's a surge. If there's an influx into hospitals, not all hospitals can handle it equally. And that's why you saw some hospitals fail. If you could do it all over again, just rewind the tape. I understand the public had many questions and concerns, and the press had many questions about nursing homes primarily. And I understand that they were not answered quickly enough. And they should have been prioritized and prioritize those requests sooner. I believe that. I understand the reasons. I understand that there was a lot going on. Everybody was working 24 hours a day. Everybody was overwhelmed. We were in the midst of dealing with a pandemic and trying to save lives. They were answering DOJ. And nursing homes and the hospitals were also in the middle of hell and the middle of a pandemic. And they were scrambling, and they were managing the crisis. I understand all of that. But the void we created by not providing information was filled with skepticism and cynicism and conspiracy theories, which furthered the confusion. Nature abhors a vacuum. So does the political system. You don't provide information, something will provide the information. Most of all, the void we created allowed disinformation. And that created more anxieties for the families of loved ones. I've had hundreds of conversations. People couldn't get into the facility to see their loved one. They couldn't get them on the phone. They couldn't get staff on the phone to get answers. They were powerless. They were helpless. They were literally physically removed and isolated. Loved ones died alone. Loved ones died alone. Fathers, mothers, brothers, sisters died alone. It was horrific. It was horrific. And then the void in information that we created started misinformation, disinformation, conspiracy theories, and now people have to hear that. And they don't know what is the truth. The truth is everybody did everything they could. The truth is you had the best medical professionals and advice on the globe. The truth is it was in the middle of a terrible pandemic. The truth is COVID attacks senior citizens. The truth is, with all we know, people still die in nursing homes today. People still die every day. We're testing the staff twice a week. There's no visitation. People still die. You would have to hermetically seal a nursing home. They actually tried this in France, where the staff lived in the nursing home. Anybody can bring it in. A delivery man brings it in. The heating repairman brings it in. The food service brings it in. Staff person goes home, meets with their family, someone in the family has it, staff member comes back, the staff member brings it in. Even when you're testing twice a week, you'll get people who have it and you'll miss them in the twice a week. That is the reality. But not providing the information creates the void. The void allowed misinformation and conspiracy. And now people are left with the thought of, did my loved one have to die? And that is a brutal, brutal question to pose to a person. And I want everyone to know, everything was done. Everything was done by the best minds in the best interest. And the last thing that we wanted to do, the last thing that I wanted to do, was to aggravate a terrible situation. There is no good answer when you lose a loved one. I lost my father years ago. I still go through it over and over and over again. What should I have done? What could I have done? What should I have said to the doctor? I probably always will. Last thing I wanted to do was to aggravate that for anyone. With that, let's take questions.
The story. We want to bring in someone who has been watching this very compelling news conference with Governor Cuomo, who's been under a ton of pressure. We're joined by he's going to be coming. There he is. He's joining us in a second. The Democrat New York State Assemblyman Ron Kim. His uncle, former U.S. Army Captain Son Kim, died in a New York nursing home after he battled COVID last year. Assemblyman Kim is one of a growing number of Democrats who are now pushing back against their own governor in the wake of what appeared to be a cover-up in New York as nursing home deaths escalated in that state. Cuomo's team apparently hid data because they feared that it would be, quote, used against them. Moments ago, New York State Assemblyman Ron Kim, he is part of a push to hold Governor Cuomo accountable. He's also the chair of the Assembly's Aging Committee. So this is obviously a subject that is near and dear to your heart. Assemblyman Kim, thank you very much for being here. right off the bat. You just listened to the governor. What did you make of his response?
I mean, he didn't address the core problem that we're dealing with. I mean, if Secretary DeRosa came to us and told us those things, I think we could have disagreed and we could have argued back. But that's not what she did. That's not what she told us. The moment that the secretary admitted Governor Cuomo directed his administration to cover up information to avoid a federal investigation, this no longer became a private conversation among Democrats to go over a question. They implicated all of us listening into that call to their cover-up. So, as state lawmakers, this is not about being a Democrat or Republican or whichever party you're from. We have a moral duty to speak up against their egregious actions and hold everyone involved accountable, including the governor.
This whole thing sort of started to unravel for Governor Cuomo. He made this statement on January 29th at sort of a news wreck of a conference. Watch this statement from January 29th.
We're below the national average in number of deaths in nursing homes. But who cares? 33, 28, died in a hospital, died in a nursing home. They died.
So around that time, Letitia James, the Democrat attorney general who works, in the governor's administration, she came forward and started to raise some real questions about accountability and the decisions that were made. And you say that, you might have shed a few tears. It was so big for you when that happened, that you saw sort of the dam breaking here on this. Why was that?
Yeah, Martha, thank you for bringing that moment up, because I've been working on this since the beginning of the pandemic. My constituents came to me crying back in early April that there's COVID spreading inside the nursing homes, and they can't talk to their mothers, their fathers. They're being kept out. And during that time period, Martha, as I'm helping my constituents, my uncle died of presumed COVID at a local nursing home in Queens. Just like many families, I was like, we just saw him in January. He can't possibly have COVID. And the next thing you know, 2-3 days, he passed away alone, suffering. And Governor Cuomo tries to empathize, says that he knows how that feels, that he does not know how that feels. Governor's mother is well off, protected in her home. She does not represent the thousands of immigrant and minority and all sorts of communities that have loved ones that are still stuck in nursing homes, worried that the governor and the administration is hiding information about life and death.
So that report came out from Letitia James, which, raised a lot of questions about the reporting on this. Then it was compounded with the phone call that you were on for Democratic lawmakers when Melissa DeRosa said this. Let's put it up. She said, in addition to attacking Cuomo's fellow Democratic governors, DeRosa said Trump, quote, directs the Department of Justice to do an investigation into us. And basically, we froze, because we were then in a position where we weren't sure if we were going to give the Department of Justice what we were going to give them was going to be used against us. So he's saying today, that's not the way it sounds. What really happened was that we had a state investigation, we had a DOJ investigation, so we held back on the state numbers while we addressed the DOJ. And he said over and over, Assemblyman, look, we did the best we could. These people, the rates of how quickly they were dying before and after March 25th when that directive came out really didn't change. This is what happens. It attacks older people. So he's saying, as much as everybody wants to blame somebody, it is absolutely not his fault. Has anything changed based on what you just heard?
I mean, I think that's the talking point. That's the script that they wanted to tell us, right? Oh, let's go take care of the federal inquiry first, and then we'll get to you. That's why it was delayed. But that's not what we heard. That's not what she said. She even prefaced the whole thing by saying, I'm going to tell you the truth. This is the whole truth. I mean, it was almost as if it was in that movie with Jack Nicholson and A Few Good Men, like, you want the truth? I'm going to tell you the truth. And then she went on to talk about the Department of Justice. So once we hear that, there's no undoing. we have a responsibility as an institution. It's not about the governor and Melissa anymore. It's about protecting the Assembly and Senate, the democratic institutions, to make sure that we do our job and we make sure that we push back and hold the executive accountable if they did such actions, which is hiding information about life and death of older adults in New York.
I mean, you couldn't be more right. I mean, one of the questions that I've asked all along, way back when we saw that U.S. naval ship Comfort docked here. I remember when it sailed into up the Hudson River and into the harbor. And then we saw all of these patients that had COVID in the hospital being sent back into the nursing homes. And people started asking questions right away. Why was the Javits Center not used? Why didn't they spread these individuals out? Why send them back into the most vulnerable population that there is?
Right. And Martha, even before that, the governor keeps saying, well, we have to make space for the hospitals. All the data points show that we weren't at full capacity. We ended up giving away ventilators. So what happened between March 25th and the end of May? Why did it take so long for the executive to change course when every other state recognized the fatal mistake they might have made by sending COVID positives to nursing homes? They immediately rescinded. They immediately changed course. It took us almost 2 months before the governor decided to change. In fact, a month later, at a press conference, he said he didn't know about it. He lied. Just like he's lying right now to today's press conference about sending notices to the Assembly and Senate that we knew about the Department of Justice investigation. We were not informed. We were not told there was an investigation.
You make a great
August.
point. I mean, I remember the body bags that were, stacked up in the trucks outside of nursing homes. I think that one of those was in Staten Island.
Dennis, you had a second question?
Yeah, just going back to the story that we had today about the budget negotiations and some lawmakers talking about the threat of subpoena or, rescinding your emergency powers. You kind of touched on this earlier, but I'm just curious your response to that. And, have you spoken to the legislative leaders about this?
Yeah, Dennis, that is a crime. You can't say, I'm a former assistant district attorney. You can't use a subpoena or the threat of an investigation to leverage a person. That's a crime. It's called abuse of process. It's called extortion. Question before was, is that raw politics? No, it's not raw politics. That's criminal. And I don't know the facts. I wasn't in the room, but in the room, you have lawyers, you have former prosecutors who are in that room. They know it's illegal. But no, I didn't talk to the leaders about it.
So my question to you is this. Several members of the legislature, some Republicans, some Democrats, have asked that there be an investigation of what happened. If that investigation was done, it might be, for example, be done by the Attorney General. You're a former Attorney General. If you were in this situation and looked at this fact pattern, would you open an investigation of what has happened so far? And my second part of the question is, do you think that if there wasn't an investigation and the Attorney General agreed with everything that you said, that it would help clear the air?
Marsha, I don't think there's anything too clear here. It is a fact that the state legislature did a request. We told them we were not going to address the request at that time, that we were going to honor the DOJ request first. We said that. That's a fact. There's nothing to investigate there. And then we provided information to DOJ. So there is nothing to investigate. I'm telling you, I agree to the legislature's point. They sent a letter, and we said that we would deal with the DOJ first. I agree. I said that. They were told that. And by the way, they could have objected. They can send a demand letter. They're not talking about subpoenas. They could have sent a subpoena and said, we don't want to wait for DOJ. We're going to send you a subpoena. They didn't do that. They understood that we were dealing with the pandemic and that we were giving DOJ precedence. And by the way, I think they were right in that. All the numbers we produced were exactly right. We didn't provide all the information that was requested. That did create a void, and misinformation did fill the void. And that misinformation gave people aggravation and confused people who lost a loved one, and allowed conspiracy theories to fester. And that aggravated people who lost a loved one, because now you don't know what to believe. And that is the last thing anyone wanted to create. But it's not a legal question.
He was just asked, he basically said, you guys, the legislators, talking about wanting an investigation. He says it's not necessary, that all the numbers that he gave were accurate, even though, according to our numbers, they went up by about 40%, the nursing home deaths numbers, from one report to the next. What would you say to the governor if you were in the room right now?
If there's nothing to hide, why don't they just hand over the information when we asked for? The information was available, right? They could have just disclosed it, but they chose not to. So there's a distrust among the public right now. And again, this isn't about the governor. This isn't about any one person. This is about the 15,000 families who lost their loved ones, and the families who have loved ones at home, at the nursing home, still suffering, to give them a sense of justice and trust again in our state's ability to protect them. So I do believe we need a thorough investigation, whether that be an independent commission or the Attorney General or the federal government, and that needs to happen as soon as possible.
Okay. Assemblyman Kim, thank you very much. We're sorry for the loss in your family and so many other families in these stories that we keep hearing. Thank you very much, sir. Good to have you here today.
Thank you.